And of course, now globally, antimicrobial resistance, AMR, has become a well-recognized public health threat in the recent years, and interventions to reduce its burden and have been launched worldwide. Like many countries, Nigeria is no exception in the challenges faced due to AMR, the emergence of the multi-drug resistant organisms that have led to the increased mortality and economic burden has increased almost exponentially. Global research on antimicrobial resistance projects suggest that bacterial antimicrobial resistance will cause 39 million deaths between 2025 and 2050, equating to 3 deaths every minute. The prudent use of antimicrobial drugs cannot be more strongly emphasized than now. Nigeria, being the most populated country in West Africa, has to take the lead in tackling antimicrobial resistance using the One Health approach, which acknowledges the links among humans and animals and the environment as the cornerstone of its plan. Access to basic health service also vary, especially in the rural areas, due to poor access to information, leading to underutilization of services and further health inequalities. Interesting. And joining me live to help get us to get a better sense of the emerging public health interest is a director of research from the National Veterinary Research Institute in Plateau, Dr. Sati Ingulukum. Please just tell me I pronounced that name well. I tried?
Yeah, you tried. You tried.
Thank you so much.
Tried.
Thank you.
Yeah.
I think that this is an emerging global threat that needs to be quickly dealt with if we don't have to, if we don't do something on time about it. And if you look at the antimicrobial resistance has been tagged as an apocalypse of some sort of scientists due to, due to the emerging public health threat. Tell us more about how serious we should be worried about this particular incident.
Okay, thank you very much. Just like you mentioned, it's a global threat. It is a silent pandemic that is waiting to happen. And silent because, antimicrobial resistance is not something that you can see, physically and say this is a disease, so to say. That it is a serious threat. Just like the statistics that was just you mentioned, if the world or globally, if we don't do something about antimicrobial resistance, by 2050 it is estimated that 10 million people will die. And so that's a huge number. But like we said, we can do something about it. And antimicrobial resistance, as we know, is, it is, bacteria or microorganisms are usually treated with antimicrobials. Now, before the advent of antimicrobials, that means before the development of antibiotics, many people were dying until a researcher and a scientist, Fleming, came up and discovered antibiotics. And then the use of antibiotics drastically reduced deaths and mortalities caused by bacteria. Now, these bacteria or these antibiotics that ordinarily would have, killed this bacteria are becoming resistant now. And that is why it is a serious threat. But the good news is that if we do something about it, we will reduce the burden of this threat. And that is why it is important that, the public generally know the consequence of this silent pandemic. And of course, the driver of this antimicrobial resistance has to do with, misuse, overuse of these antimicrobials, whether it is in the animal health sector or in the human health sector. And remember, it also, affects the environment because we all interact within the same environment. Both the humans, the animals, we all interact in the environment. And these bacteria, many of them are shared by both humans and animals. And of course, like I said, because we interact within the same environment, some of these pathogens or bacteria get into the environment and will also affect either humans or animals.
Okay, so, it's been said that AMR by 2050 will have like 10 million deaths. Yeah. And this is a very staggering statistics, looking at it from 2025 into 20, that's like 25 years. Yeah. So by 25 years, if we don't do something about it, that means that 10 million people will have been dead by then. So what are the ways that we can curb the rise and reduce the burden of MR and, of course, avoid this death? Because if we don't do something about it, then there's a bigger problem in trying to avoid some of these things that needs to be done. How do we curb this?
So, exactly. Like I said, what are the drivers of this antimicrobial resistance? So if we know what is driving this resistance, and then we now act on it, then we can reduce the burden. And I told you that one of the major drivers of this antimicrobial resistance is either overuse, underuse, or generally misuse of antimicrobials, whether it is in the human or in the animal sector. It has been estimated that, about 73% of antimicrobials or antibiotics used in the world globally is used in the animal sector or livestock sector. And it has been, estimated that when, they reduce the use of antimicrobials, okay, it has also reduced the prevalence or the cases of antimicrobial resistance. So what we need to do is to, advocate, to create awareness, because awareness is very, very key, so that people use antimicrobials responsibly. You find out that most people, they can just walk into, a pharmacy and just buy antibiotics, which is not proper, because for you to take antibiotics, whether for humans or to be administered for animals, it should be prescribed by a doctor or a veterinary doctor or a qualified, personnel that is authorized to prescribe. But most times, people just walked into, pharmacies and buy drugs and use. And this drives this AMR. One key thing that we also need to do is simple, infection prevention control. Okay? If we reduce infection, then there will be no need to use antimicrobials. Simple things like washing of hands. Okay? For farmers, instituting biosecurity measures in their farms, by using disinfectants. So and then also vaccination, because these are all preventive measures. So once you prevent infection, there is no need to use antimicrobial, okay, so or there will be reduced use.
Now that you even talked about farmers, you said that disinfectants that can help reduce it.
Yeah.
Let's say, for example, you have a farmer who went to the farm, and does that farmer has to take a disinfectant to the farm? Because remember, once he finishes from the farm, he's going to meet different people.
Yeah.
So that means that the transmission of those, is it transmittable? If not, so how do we mitigate it against such?
So, like I said, if you have a farm setup, whether it's a poultry farm or a livestock farm,
yeah.
Okay, the farm is supposed to be, enclosed.
Yeah.
So
enclosed,
yes, especially for poultry farms.
Yeah.
Okay, so at the entrance, okay, there is supposed to be a dip. So anybody that is entering that farm should disinfect the footwear. In fact, in big farm, you should even change your wares Okay, the ware that you come in from outside should not be the ware that you use to enter the farm. That way, one, you are preventing, taking an infection into the farm. And then when you are also coming out, you change so that you don't take infection
from the farm
outside. Remember, some of these bacteria, like I told you, are zoonotic. They affect both animals and humans. So they can come from animals to humans or from humans to animals. So the essence of, this disinfection is that at any point, remember during COVID, that was one key thing that reduced the spread of COVID.
Yeah.
Simple hand washing and use of hand sanitizer. So it's the same thing. At any point, if we touch this surface, for example, and you go backward, remember you can touch it. If there's an infection here, you take it to your hand, to your mouth or your eyes, you are likely going to transmit that infection.
Yeah.
So the essence of disinfection and hand washing is to reduce, the chances of getting infected. And like I said, when we reduce infection, there will be less use or less demand for the use of antimicrobials. And I told you that because of the overuse of antimicrobials is a driver to antimicrobial resistance. So if we reduce infection, there will be no need or low use of antimicrobials, which will reduce, the potential for this bacteria to develop resistance.
Okay, so now that the health approach is necessary, and one has been said to be the one to help reduce, tell us more about this approach through human, environmental, and animal health. Because if it is an approach that is working, then there must be something that we must all know and how to apply it in our day-to-day lives.
Okay. So thank you. Like I mentioned, it is a One Health issue. And One Health means the environment, the animal health sector, and the human health sector. Like I said, we all, interact within an environment.
Yeah.
So, as a country, there's a global action against antimicrobial resistance, which was developed by the WHO. So it's a global, plan. And each country has also adopted and come up with its own national action plan. And in this national action plan, each country, comes up with strategies on how to cope or reduce the burden of this antimicrobial resistance. So, and in Nigeria, for example, these three sectors, the human, the animal, and the environment, have come together and developed this document, which is, in operation now. Okay, and the essence is that these three sectors come together because, like I told you, if it is not addressed at the human interface, at the animal health interface and the environment sector, we will not achieve. We will not be able to achieve. And so these three sectors, we need to come together using their expertise. Okay, once this expertise is pulled together, then we can address this thing. Because like I said, once you have a resistant strain from animals, it can get to humans. And remember, if for example, I have a resistant strain, it can come out from me, maybe through feces or other things, into the environment, and it gets into the water system. And then people drink that water system and can get infected with that resistant strain. Also, the food system. Okay? Milk, meat, okay, and other, food of animal origin. They can be sources of this resistant strain to humans. And they can also spill into the environment and then get back to whether it's animals or the humans. And that is why it is very key and very important that, we looked at these three sectors in, coming up with strategies to reduce the burden of this.
Okay, so now talking about strategies, let's talk about the implementation of this.
Yeah.
Because one of the issues that Nigeria has is that there's a lot of laws, a lot of policies, but the problem is execution of those laws and policies is now become the problem.
Yeah.
So how does government change its radar to make sure that we implement these things for the benefit of all, knowing that health is wealth. How does government do that?
So thank you very much. Like you said, I heard there's some news that you read.
Yeah.
You saw what NAFDAC is doing.
Yeah.
So NAFDAC is implementing some of those policies, some of those laws that government has come up with. And that is what, there are, we have a lot of laws, we have a lot of legislation.
But there seems to be resistance from that.
Yes.
People are resisting.
People will naturally resist.
Yeah.
But it is the responsibility of government to enforce. That's why we have security agencies. That is why we have regulators, because we have to, because if we don't, we are exposing the whole, nation to danger. So we have to enforce these laws.
Yeah.
So I'll call on the government to continue to strengthen the enforcement of some of these regulations. Like one of them is, I told you, in some countries, in many developed countries, and even countries around us, small countries around us, you can't just walk into a pharmacy and say you want to buy antibiotics unless you have a prescription. But in our climate, in our country, unfortunately, it's not as if those laws are not there. They are there. But we don't, we like, we don't obey laws. But we have to be,
so that also has to do with the health practitioners themselves. Because if I come to you and says, I want to get an antibiotic, you are supposed to ask me, where's who gave you the prescription?
That is true.
Yeah. So I don't think that it should not be a one-way drive. As the government is also doing this, the medical practitioners who are saddled with that responsibility should also be able to be like a check between the people and the government. But it looks as if they're not even doing that as well.
You are right. So all of us have responsibility. Okay? As individuals, as communities, as governments, we all have responsibilities. Like you said, yes. But I can tell you that there are some facilities that if you go to buy antibiotics, if you don't have prescription, they will not sell. Okay? There are people that are doing their job. There are also those that are not doing their job.
Exactly.
But what we continue to advocate is that let all of us be responsible.
Exactly.
Because if we are responsible, then we will help. We are not just help. Remember, even if you don't do what is right, this pathogen does not respect class.
Class, yeah, exactly.
It does not respect border. Once you have a resistant strain, remember, if you have a especially, remember I also saw in the news item talked about multi-drug resistance.
Yes.
That means no any antibiotic will be able to treat that infection. And once it gets to that point, you are now left at the mercy of death or life. So it is something that all of us has to take responsibility.
Interesting.
So, especially, let me just mention this, especially our farmers. I need to say this. Farmers, like I told you, it has been estimated that globally, 73% of antimicrobials that is used globally is used in livestock. Okay?
Yeah.
And I've told you that one of the major drivers of this resistance is the misuse of antimicrobials. Most farmers will just go to the drug shop, and in fact, even in the open market, people sell drugs, especially veterinary drugs, including antimicrobials. And they buy this thing with no prescription. Every farmer is a doctor. Okay? He prescribes for himself and administer. And the funny thing, if they administer one day, for example, even if it is a correct prescription, and an antibiotic is supposed to be taken for 5 days, they give for 1 day, 2 days, they stop. Those are some of the issues. Okay, so we continue to advocate that. Let's use these antimicrobials responsibly. And thank God you have a responsibility as journalists to continue to create this awareness in our people. Like I said, it affects anybody, everybody. Nobody is safe. All of us are at risk
of it. Exactly. That's what we're having in the discussion. Yeah. He said that by 2030, antimicrobial resistance could force up to 24 million people into extreme poverty. That's very interesting.
Yeah.
Tell me about this.
So you know what? One, let's look at it's also, in fact, it has been estimated that by 2050, antimicrobial resistance will cost about $100 trillion in economic terms. Okay? Now, look at if people are sick and have to go to the hospital, they have to stay in the hospital, you can imagine the economic impact. People are not working, going to work. Okay? Now, in terms of livestock production, if animals can no longer respond to antimicrobials, it will reduce production. Yeah. And remember that most people, are into livestock production, and that is their livelihood. So once there is reduction in livestock production, okay, especially in the rural communities, it's going to, it will increase the level of poverty.
Interesting.
Yeah.
Thank you so much.
Thank you.
Thank you. I really appreciate Director Research from the National Veterinary Research Institute in Von Plateau State, Dr. Sati Ngulunko.
Ngulunko.
Thank you so much.
Thank you very much.
Thank you. I really